we'll restart.
Just got it.
All right. Hello and welcome to another episode of the Snackbreak podcast by OrthoSnacks. I'm your host, John Schaefer, and on this podcast, I interview physical therapists, fitness professionals, and health and wellness experts. My guest today is a double graduate of Stony Brook University, where he received both his undergraduate and doctoral education. In addition to his DPT, he has pursued additional subspecialized training in sports and performance therapy, earning both his CSCS and board certification in sports physical therapy. He's currently the director and coordinator of sports medicine for St. Charles Outpatient Physical Rehabilitation Network. Outside of this role, he's the founder of Fitness and Movement LLC, which focuses on hypertrophy training, physique transformation, and injury management. And he recently started a Discord community for students and clinicians interested in growing their practice within the world of sports therapy. He is Dr. John Kahl. John, how are you?
Good, John. Thanks for having me. I appreciate it. And looking forward to diving into some topics with you today.
Yeah, and that was the last thing I was going to ask you before we went live. Did I pronounce your last name right? Is it Kahl or Kahl?
Kahl, you got it right.
Kahl, all right on the money.
Which is a rarity.
Yeah, good to have you on the show, though. I'm excited to talk. I know we've been chatting a little bit just over Instagram the last couple months as you got in the Discord started, but I'm excited to ask you, a couple different questions about things that you're doing nowadays. So for those who aren't familiar with you, John, tell people, who is John Kahl?
All right, who is John Kahl? So I'll dive into my professional background, then I'll give you a little bit about my personal background. So professionally, I am the sports director or clinical coordinator is my official title at St. Charles Hospital. I am from Long Island, New York. And I work with my colleague, Keith Levinson. We co-direct the program for our sports medicine team and our sports medicine program. So I have a clinical role where I'm treating. And then I also have an administrative role where me and my colleague work together on program development. We work on community outreaches. We do a lot of community screens. For example, we also covered the Suffolk County Marathon, which was in October of this year. So we do a lot of outreach and community stuff like that. And then I also have a role of running our social media page. So I really love treating athletes. That's really where my passion lies. And, as an athlete myself, or I should say a former athlete, just a washed up athlete now, I really do feel like I can vibe well with this clientele and this population and really speak to them and understand where they're coming from. And I really feel like that, as a sports therapist, that gives me a little bit of an edge to really help these patients and these athletes along. So sports rehab is where my heart's at. I myself, I was a basketball player for pretty much my whole life. So basketball is my main sport. I really love playing it. I love watching it. I follow it. I love treating those types of athletes, the basketball athlete, as well as just doing strength and conditioning for them as well. But, my passion also lies with ACL injuries, the knee, lower extremity type stuff. I do like treating upper extremity and spine, but I think my wheelhouse lies in the lower extremity. But that's my role at St. Charles Hospital. I also have a business called Fitness and Movement LLC, and we are an online training and coaching platform where we really target athletes who want to make physique improvements. So those who are looking for hypertrophy training, right, building muscle, whether it's building muscle, losing fat, really just transforming your physique. That's really where our wheelhouse lies with that. That's me and my colleague, Dan Lorenz. So Dan has been training bodybuilders for over a decade now, and I'm just shy of a decade, but we really have a good experience with bodybuilders and the fitness athlete. So that's really what we do with Fitness and Movement. And, that goes anywhere from anyone who just wants to, maybe they're starting their fitness journey, and they want to improve how they look and how their physique looks, or maybe it's the 10-year lifter who's having some nagging shoulder pain, but, they can't get past it. So with our PT hats on, we can work ways on, and we're not treating injuries per se, but we can have ways to kind of work around things and make sure that we're not irritating things, and then point them in the right direction if they really need to see some medical help. But it's a good hat to wear, and we kind of see a nice variety of those. And we also train sport athletes as well. So as I said before, my basketball passion, I have 3 basketball players who I work with now, just working on sports performance training, getting them in as best possible shape that they can so they can transfer to the court. I have a client who is an avid volleyball player. She plays competitively. So we have a pretty well-rounded clientele, which is nice. And then I also I do a bunch of different stuff here. It's kind of crazy. So then I'm a teaching assistant for Stony Brook University. So I love teaching. I mean, I feel like that's another thing where one of my passion lies, and a lot of the roles I have affords me the opportunity to actually teach and help others. So I'm a teaching assistant for orthopedics in the physical therapy program, and I really enjoy doing that. I like being in the classroom. It keeps me sharp. I like connecting with the students. It's a good time. And then I also have a online platform for sports physical therapy and performance training, education, and mentorship. And that's the All Things Sports Physical Therapy Discord.
All right. Can tell you're doing a lot of different things, kind of integrating all your interests, making sure there's a spot for all of that. So that's super cool to see. I've talked to over the last few episodes some other different physical therapists who specialize in sports, and just hearing about their journeys, it sounds like one of the big ways to get an upper hand in the world of sports is to know you want to do it from the get-go. Would you say that was the case for you, or can kind of take me through what your journeys looked like, maybe in different positions, as a physical therapist interested in specializing in sports?
Totally. Yeah. I mean, even before I found the profession of physical therapy, when I was an undergrad, and I was kind of like, what do I want to do? I always knew I wanted to do something in the form of athletics, whether it was fitness, whether it was nutrition. And I also liked the medical side of things. So when I stumbled upon physical therapy, it was like a perfect match. It was like, a blend of the two best worlds, right, coming together in physical therapy, because you have the fitness side of things and the exercise and things like that, and then you also have the medical side of things. So pretty much I knew I wanted to do something with athletics and athletes really from the get-go, before I even started my journey in physical therapy. And then throughout school, when I had some experience and stuff like that, I'm like, this is definitely the route I want to go. And it's funny because I remember when we were doing our clinicals, obviously the school wants you to have a nice, well-rounded experience, so you have to do an inpatient as well as an outpatient experience.
Mm-hmm.
And I did my inpatient one first, which I'm not gonna lie, I knew I wanted to do sports. I'm like, oh, I'm gonna hate this. I was in a nursing home. I'm like, I'm gonna hate this. And I really loved it. It was definitely eye-opening, and it was definitely a great experience to have. But I always knew I wanted to do sports. So after I got my inpatient rotation out of the way, the last 3 that I did were all like outpatient based, and got some pretty good sports experience, and a lot of general outpatient orthopedic type experience. So I kind of knew from the get-go. And then one of my clinicals was actually with St. Charles, the facility that I work for now. And I was exposed to the sports medicine program, and I'm like, this is definitely where I want to be. This is what I want to do. I see a lot of opportunity, a lot of growth. And I think these guys are doing the right thing. And it really caught my eye. And I knew from that point, I'm like, I'm going to make this happen. And I really want to pursue his career in sports and really take it as far as I can go and try to be the best therapist I can be for, the patients that I see.
So then were you always at St. Charles following graduation, or did you have other positions?
No, St. Charles was my first and only position, full-time position, I should say. I do some outpatient coverage here and there, but that's a little sporadic at a different facility. But that's, my only full-time position is through St. Charles.
Okay. So then talk to me just a little bit about when you decided to get your board certification in sports. Is that something you always knew you were going to do, or did you notice like there were gaps in your care that needed to be filled? Kind of what led to you pursuing that? And then maybe how has it changed your practice?
Yeah, I would say honestly, since school, when I first learning about like board specialties, and I started finding people in the space that were, pursuing educational excellence and just clinical excellence, I was like, oh wow, this is something I want to do. Like I always liked orthopedics and sports, so I was like, I should get my OCS or my SCS, because I feel like I'm like a lifelong like nerd. I always like learning and like doing better and like reading and educating myself. So I'm always doing that process of self-improvement. So I'm like, this is literally like one of my career goals. I want to get this, and I want to get it as fast as possible. So basically that was a career goal for me. And, I pretty much tried to get all my ducks in a row as quickly as I could. And I knew with the program that I had, I would have enough sports experience to sit for the exam, because not only do you need the clinical hours in clinic for physical therapy patients, but you also need like the on field, or the, that peri window of athletic events, whether it's 24 hours pre, during on the sideline, or 24 hours post. And, I was able to get a lot of that experience through where I work, which I'm very fortunate for. So once I had enough experience, I sat for the exam, and I'm totally happy I did. I mean, I will really tell anybody, if you're a nerd like me and you want to just learn more and get better at your screening skills, your medical skills, and you really diversify your skill set and really, speak to a certain niche, then I would strongly recommend going for a board certified specialty, because I feel like I learned so much from it, and I'm very grateful for pursuing that, and it's really transformed the way I treat, I screen, and sometimes the way I look at things. But also too, with that being said, it's not the end all be all. Just because you have letters after your name doesn't mean that you're using the information, or that you still like look through it, right? You might have just studied it for the test and you forgot half of it. So the letters are nice, the certification and the distinction is nice, but it's all about how you use that information, and are you continuing to learn afterwards and really sharpen those skills. But that's kind of my journey to the SCS and how I got to it. So totally
Okay.
happy I did.
Yeah, that seems to be one of the big sentiments surrounding board certification as well, is that, it's not so much having the letters itself, it's kind of the journey of studying to get there and all that information you're learning along the way. One question that I do get a lot, and I'm able to answer somewhat well, but what would you say the biggest factor should be going into deciding whether to pursue like SCS versus OCS? Because I know there's a little bit of overlap between orthopedics and sports. Some people will argue or say that, orthopedics is the base for everything, pursue that route. Others will say go sports, it's more specific. If you want to do sports, go that route. What would you say, or how would you weigh into that conversation?
Totally. And that's something I was considering as well. I'm like, do I go for my orthopedic specialty? Do I go for my sports? Do I go for both? And I knew my passion lied within sports rehab and treating athletes. And that's the direction I wanted to pave for my career, is really opening up those doors to specialize and treat athletes. And with anything, I mean, orthopedics is the background for sports. There's no doubt about that. But with the OCS, again, I've never studied for it, but just talking with colleagues who have, and just kind of doing my own self research, it's going to be, you're going to get some sports related, information, but it's going to be geared towards the general population. And that's great, because, you're still going to get a lot of screening skills. You're going to get, a well-rounded orthopedic, education that far, supersedes anything you would learn just from school. But for me, my heart was in sports. I was like, I really want to learn about sports injuries, the thrower, right? The overhead athlete, the endurance athlete, the ACL athlete, all kinds of knee injuries, foot, ankle, spine. What do we do when you have something that's like maybe emergency management? I thought that was a cool side of things. Not to say that I would particularly use that too often, but I think it's nice to have that background and understanding that. And then I know the SCS still goes into some sports performance training, a little bit of nutrition, things like that. So that's kind of where my heart lied. So I always say, if you want something that's a little bit more, say, applicable to the general population, cast a bigger net, right? I would say go OCS. But if you really know you want to work with athletes and you really want to learn more about them and kind of carve that path, I would say go for your SCS.
Okay. Appreciate the perspective. I've asked the question a few times before, and I think it's helpful just to see different responses from people on both sides of the field. So you mentioned before that one of your bigger passions is working with ACLs. So I want to pivot a little bit towards discussing that population. And so I would just want to lead off. Why do you think ACLs are something that's a little bit more challenging for patient or for therapists to treat? I know it's a situation where throughout all my clinic rotations, I only worked with one patient who had torn their ACL. So it's not something I had a lot of experience with. So do you think it's just maybe has to do more with where the student or where the therapist is practicing, or what would you say some of the biggest challenges are?
Yeah. A lot of general outpatient orthopedic clinics may not see a lot of ACLs, like you said. I mean, if they're really targeting the general population, they may not get a lot of ACLs. And when they do, no fault to them. If you're not seeing it and you're not entrenched in it and you're not pursuing how to treat them, when you get them, I'm going to say the care might be a little subpar for what they may need. And I'm not faulting the clinician for that, because, if it's something you don't see that often, how are you going to really, cater to the specific needs of that specific person or that athlete. So that's like saying, like, if I saw somebody who came into me for like TMJ dysfunction, can I treat it? Sure, I can treat it. Am I going to be an expert at it? No. I mean, would I be more comfortable sending it to a colleague who has more experience with TMJ? Absolutely. So I feel like it kind of goes to that route. And, when you do have an established sports clinic and you start seeing more ACLs, that's kind of where, local surgeons will probably send their athletes, especially if you have a good rapport with them. But speaking to the challenges, like you said, the ACL athlete is totally different, and just athletes in general. But I really think the ACL journey is one of those that really requires you to have like top notch, like exercise prescription skills, which unfortunately in the profession is not always there. I don't know if that's from an educational perspective or whatever it may be. I mean, the cool thing about physical therapy, is that we treat such a diverse amount of people that it's hard to really, dive in. But once you have a specialty, it becomes important. And for the ACL athlete, it's a journey. It's a journey. It's going to take at least 9 months up to a year if you want to get back to competitive sports. And some people might take a little longer than a year, and that's okay. But your exercise skills have to be on point. You need to know your milestones. When is it safe to start jogging? When is it safe to begin plyometrics, agilities? What should my strength standards be? What should the knee look like? When should I get full motion back? Other things like, should I use BFR? Should I use NMES? Things like that. Like, these are all things that require you to have, good working knowledge of the ACL journey and what you're trying to accomplish and what the common deficits are. I mean, if you look at the research, the long-term outcomes of ACL reconstructions are not great. About half of the people return to competitive sports, and there's a high rate of re-rupture. And, that's not just saying it's just all on the therapist. There's other factors that definitely go into that. But I truly believe if you really know what you're doing when it comes to ACL rehab, a lot of those factors start to resolve themselves, and you can really transition these athletes back safely and effectively. So I think your exercise prescription skills need to be on point, and knowing your milestones and things of that nature. So I think that gives clinicians the most, problems when it comes to ACL athletes, and especially if they don't see them that often.
All right. So the next thing I'd like to chat about, you talked about it a little bit in the beginning, but your company that you're running on the side, Fitness and Movement LLC, what originally led you to kind of form this company? What need were you looking to fill? What was it like starting it at the beginning?
Yeah, good question. So I always liked training, and then whether it was that training myself, and talking about, in the weight room, weight training, resistance training. So I always loved doing it myself. And I was like, I can help others because I'm just so entrenched in this and I'm just learning and stuff. I'm like, I want to help others. So I started training small groups, like on the side in person. And this is going back to like 2013, 14, early on. And, I got some experience and a little trial and error. And as everything, as you learn more and you practice more, you apply it, you see what happens and you tweak things. So I started getting better at that. And then in physical therapy school, I was like, why don't I just start like an online platform? I think this is a great way to reach people that I may not be able to reach in person. And then also I can do it while having some time constraints, because I don't have to set like an hour block to meet with somebody at the gym and, train them in person. I can kind of do it remotely with video feedback, detailed exercise programming and things like that. So I started my own thing, and I really had a small little group, and I had a couple clients. I had some power lifters. I had some physique athletes who wanted to just look better, gain some muscle and things like that. And, one of my really good friends, Dan Lorenz, he came to me. He's like, John, he's like, why don't we make this like an actual like business? And why don't we just get a website and look for an app that we can use? And it started from there. So we built Fitness and Movement, just the Instagram handle in I think it was 2015. We started the Fitness and Movement Instagram handle, and we didn't really have any direction at that point. We were just posting about physical therapy and a little strength and conditioning here and there. And then when Dan approached me about that, we turned it and flipped it into something that was geared towards online training. And then one of my passions, as I said before, and one of Dan's passions is bodybuilding and hypertrophy training and just physique changes in general. How do you improve your aesthetics in the gym and things like that? So that's really where we got started. And then we created an LLC and really hit the ground running. So that's how we started into Fitness and Movement. And now we have a really good clientele base and seeing some great results. And it's very rewarding to, help somebody and see their progress over time. Just like in therapy, it's great to see.
Yeah. So what would you say some of the biggest challenges were getting started? Like you mentioned that you've made or use an app to communicate with your clients. Maybe just talk about some of the resources that have been helpful in propelling this business.
Yeah, I think one of the big challenges that we had initially was just finding like an identity for us. Like, what were we going to focus on? So, we're kind of all over the place. Like I said, I had some power lifters, I had some recreational bodybuilders, and then I also had your general population who just wanted to get in shape. So we were kind of all over the map, which was fine. But our marketing message was not specific to anybody, and we
Hmm.
were like, all right, we need to kind of target and like niche down a little bit and find somebody that we can really speak to. So, if you speak to everybody, you speak to nobody, as that saying goes. So we are like, let's dial this in a little bit. And we really focus on our marketing message, and everything is towards hypertrophy training and, improving aesthetics in your physique. So I think that was one of our biggest challenges. As far as platforms and resources, we both have our CSCS, which helps, but we needed more knowledge on hypertrophy training and things like that, not just sports performance stuff. But having a good background of that coming into this was definitely helpful. Like Dan was training bodybuilders for a long time, and I got into this, into that population, a little whiles after him. But just growing and reading some research articles and following the right researchers and reading books and things like that, and then applying it really helps. We have an app. It's called True Coach, which is a great platform online. We use that for our clients. It's great. And then all of our feedback, and if we have to do intakes, our intakes for our clients and our monthly assessments are all done through Zoom.
Okay, nice. And how are you balancing all this on top of your work in clinic?
Um, Good question. So, I mean, it's not as time consuming as it may seem on the surface, because I've been doing it for a while now and I've gotten very efficient at doing it. So, I'll set out a block of time when I know I have it every single week at the same time. And I go through programs, I do feedback, and things like that. And I just really, it's making sure that you set time in your schedule to make it happen. Otherwise, you're going to be scrambling like, oh crap, I didn't do this, or I forgot to change their program, or I forgot to touch base with them. So, really just finding a time in your schedule and just committing to that time is huge. And like over time you get more efficient at it. So it's not as time consuming as it may seem, but it does take up some time, but it's good time. I like I said, I enjoy doing it, and I enjoy seeing the results that our clients are getting.
Yeah, well, one of the trends I'm noticing over the course of this interview is just all your responses. You're saying these are all things I enjoy. The population you're working with, the things you're doing, so everything kind of snowballs, and is leading into something where it doesn't necessarily seem like it's a whole lot of extra work for you. It's more so, something you enjoy doing and seeing all these different results positively for individuals. So talk to me just a little bit now about what your day-to-day is looking like. It seems like you got a lot of different things you're trying to balance. How are you fitting everything in, and what does your current role look like in clinic?
Yeah, so in clinic, I have a clinical role where I treat, which is most of my time, but then I also have an administrative role where I work on program development, community outreach, and social media and things like that. So I have my set hours for clinic, and then I also, whether it's on a lunch break or whether when I get home from work or it's before work, I set time to, work on social media posts for, my continuing education business or for fitness and movement or whatever it may be. So I kind of just structure time slots as is. And, the funny thing is you keep doing this stuff, like ideas start coming naturally. So like, I'll be like at work, or I'll be like at the grocery store, at the gym, and like an idea pops in my head. I'm like, oh, that's great. So I just jot it down on my phone in a note section, and then I have content. So all I got to do when I sit down and take some time is just, here's the idea. Let's just make it into content. And then there it is. So, my day to day does fluctuate because my work hours, I have a couple morning shifts, I have a couple evening shifts, which is, for if you're trying to treat sports and athletes, you get a lot of high school athletes you have to treat in the evenings because they're in school during the day. So my schedule does flip flop a little bit, but I find, plenty of time and to be efficient and make all these things work. I think the biggest key is is finding having efficient time, not just like spending hours on end just pointlessly doing things. It's like, no, I have an hour here. Let's make this an efficient hour. Let's get things done. And then I'll take a break and move on and do other things, you know?
Okay. And then you also mentioned your transition. So you used to be a lead sports physical therapist at one of the clinics, and now you're the director and coordinator of sports medicine. What were the differences between those two roles?
Yeah. So, in our outpatient networks to the hospital, we have about 8 sites. So as a lead therapist, you're pretty much the sports therapist for that specific clinic where you're treating the athletic cases that come to the door. You're involved in our community screens. You're involved in our recovery clinic. You're involved in our continuing education series, and your role is to not only just treat but also to educate the other staff in that facility about things that the sports program's doing or things that you may have learned from a course and things like that. So that's the lead therapist role, and we have a lead for pretty much all of our outpatient sites who are involved in our sports program. And then as the program coordinator or the program director, I have more of that administrative role where the behind the scenes things, making connections and making phone calls and making social media posts and writing programs and protocols and working on community screens and coordinating all the details behind that and all those other things come in the role of the coordinator. So those are the two distinct differences between the two.
Okay. And are those pretty common like job listings you would see in the world of sports, like sports or director and coordinator of sports medicine versus lead therapist? Like, are those pretty common across the board?
I will say that I do know a couple facilities that have similar type roles. Maybe the names are slightly different, but regardless, I mean, you can see like an outpatient clinic who just has a sports therapist, or maybe they have a women's health therapist, or they have a spine specialist. So definitely see the specialties across practices, but I think for a big company to have a sports program, you kind of need somebody who's, I guess, leading the pack and working on all the administrative stuff and the behind the scenes type thing. So I feel like it depends on the size of the clinic.
Mm-hmm. And then what would your advice be to someone who is maybe not seeing as many athletes as they'd like in their clinic? Like, what are some of the best ways to get more athletes through the door?
So for the athletes that you do see, even if it's little, treat them like gold. I'm going to say do everything you can for them, entrench yourself in their care, make sure you're doing the right thing for them and that you're trying to work on self-improvement in the process because, no, I think the best referral is word of mouth. And,
Mhm.
if you treat these patients well, they're going to talk to their friends, their colleagues, their coaches, their parents. And, it's really going to start making yourself known as an expert in this field if you can work on continual improvement and education and just getting good outcomes from them. So I think that's a huge start, is just making sure that your care is on point for them and you're treating them like gold. Number two is preparing for it, because if you don't prepare and you don't have that background, how are you going to treat them well? So kind of entrenching yourself in the literature and doing some self-learning and taking some courses definitely helps. And then also too, communication's key. So I always say if you're looking to not only just provide the best care for the patient, but also to build your name up a little bit, communicate and over communicate, talk to the parents if if they're in high school or whatever it may be, talk to the coaches like, hey coach, I have one of your athletes, taking good care of them. When the time comes, I will keep you posted. Talk to the referring physician. Thank you for the referral. I just wanted to give you a little update on this athlete, or I have a question, right? So kind of over communicating is definitely a great way to get your name out there and show that like you really care and you're doing your best to really make this athlete known. I think that's really going to help you significantly.
Okay, great advice. I appreciate that. So last thing I want to pivot to talk about a little bit is about your continuing education platform, or the Discord. What originally led you to start the Discord?
Yeah,
Maybe we can even start, just give it like a little overview of what it is.
absolutely. So I started a continuing education and mentorship platform called the All Things Sports Physical Therapy Mentorship Discord, and it uses the app, the Discord. And basically, what it is, it's like a live forum or a community chat, And I'm using it as a way to really help clinicians learn more about sports therapy, sports performance, and nutrition and things like that. And I really think the biggest problem that a lot of therapists face as far as improving their skill set is time and effort, right? So, we're professionals, we're busy, we're treating a lot, we have things outside of work. Like a lot of PTs don't have the time, or it's tough to set aside some time to actually find an article, to read it, and then to try to apply it and things like that. So I wanted to create a way to streamline clinical information and present it in a digestible way that people can read the take homes, read the limitations, but then also use it to apply it immediately, right? I think that's where the best bang for your buck comes in, is if you can take all the things you're learning and apply it. So that was a big reason for starting the Discord. I really wanted people to become lifelong learners and just learn a little bit every day. And I think that's been a big thing for me and getting to where I am in my career, is that I'm not just taking like 3 courses a year. I'm taking 3 courses a year, but I'm also learning every single day. And I'm a big self-learner. So I'm always like, whether it's on social media or if I'm just skimming through, an article, I'm doing something for process improvement, like almost on a daily basis or most days of the week. And it's small, it's digestible things. It's like, maybe I read something for 5 minutes. I'm like, oh, that's a good idea. Let me see if I can implement it, or, things like that. And this is a platform where I want my members to learn something every day, because, guess what? If you do that for 3 months, 6 months, 9 months, you're going to be a totally different person in 6 to 9 months, right? And I think that's really the way to do it. It's just to build those daily habits of learning, applying, and then assessing how well you're doing. And that was one of my big goals for the Discord. And secondarily, my other major goal for the Discord is just creating a good mentorship platform. So I have a couple different tiers, membership tiers, and my VIP tier is really acting as a mentorship for those who really want to accelerate their career in sports rehab and, get to that next level, and how to be a master and how to master their craft. So as we know, I mean, there's a lot of jobs out there that offer mentorship and they don't actually follow through. So they may say, oh, we have good mentorship and, we'll help you along the way. And, maybe that's partially true, but it's never anything structured, at least in my experience from what I've seen from other people. It's never anything that's structured. So maybe there's a more experienced physical therapist that works with you, and maybe you can ask them questions here and there, but like, there's nothing structured. And I know, John, this from just being in a residency program, having that mentorship is huge. It's literally a game changer. So, for all those therapists who maybe can't do a residency, I'm trying to kind of bridge that gap and be there for someone to discuss cases with and to help learn and, bad ideas off each other, and see what worked, what didn't work, what can we do better. So that's my other goal for the All Things Sports Discord, is really provide that mentorship that a lot of therapists don't have, or maybe they don't have a sports specialist in their clinic, but they're seeing athletes and they're like, how do I get better at this? So I want to be that resource for clinicians who really want to step their game up in sports rehab.
So this is a little bit more broad, but what qualities should people look for when they're looking for a good mentor? Maybe it's a new grad, fresh out of school, looking at different jobs, and trying to figure out, okay, is this going to be a good mentorship situation or not? Because I know there's some clinics where you can get good mentorship, but like you said, oftentimes it's maybe not structured or not as much as it's hyped up to be initially. So how do you kind of vet that if you're looking for a new job or looking for a mentor?
Yeah, it's definitely tough, and sometimes it's hard to get all the answers you're looking for. But I would say, I mean, I would question the potential mentor. Like, do you have structured meetings, or do you have any sort of formal thing that we meet like once a week or every couple days or once a month or whatever it may be, where we actually sit down and like we go over patient cases, we go over maybe some articles, maybe we talk about continuing education, whatever it may be. Is there like a structured time that's actually set aside for you to actually talk one-on-one with this person, or in a small group setting? I think that's massive, because just working with somebody who's more experienced doesn't mean that you're going to actually get mentorship out of them. And if for those that follow me on social media, I just made a post about how all experience isn't created equal. So I think making sure that your mentor is not only just like, oh, I've been doing this for 10 years, I know what I'm doing. that may be true, but make sure that they have like that attitude where they're like, no, I have a good foundation and a good grasp, but I'm still trying to get better just like you are. So I'm out there, I'm still reading, I'm still updating myself, I'm still reapplying things. So I feel like if a clinician is treating the exact same way they were like 3, 4 years ago, I don't know if they're really entrenching themselves in self-improvement. So I think those are big keys to look for, and to make sure that your mentor has, you know, experience and knowledge in what you're trying to actually improve on.
Okay. And then one other question I want to ask you about, just because you're right in the thick of it. Um, but how should how should an individual, whether it's a student, whether it's a clinician, how should they sort through the wide variety of different like fee for knowledge type services? So whether that's like courses, whether that's joining a Discord, because I feel like it's becoming more and more common for people to be putting out courses and things like that. So how are students and how are clinicians supposed to make sense of, okay, is this something legit or is it maybe not as legit?
Totally. And I feel like most things that out there probably are legit. I mean, some are going to be better than others. There's no question about it.
Hmm.
But I don't think I like to think that there's no therapists out there that are doing things maliciously. Like, let me just slap together something crappy and just give it to the public. But I think a lot of that's going to come from researching into the person that is providing the content. Do they have a good knowledge base? Do they convey it well? And that's where I think having a good social media presence helps. If you're putting out good content, you're putting out research-based stuff, you're showing that you're a good expert in your field and that you're working on self-improvement. I think that's going to speak volumes to when people like are considering buying your services or your product. And then also too, just having some social proof and seeing like, hey, someone else took this course and they liked it, they had a good experience, or they have good feedback. And I think that goes a long way. Or just connecting. As myself, I talk to a lot of people through direct messages on social media, and I think it's a way to show like, hey, one, I'm actually human, I'm not a robot, and I'm not and I'm here to help you, I'm here to kind of give you that community feel and like be a guide for you and a resource. So I think those are key for anyone who's looking for a service or a product and they're unsure of whether to participate in it or not.
Okay, cool. I appreciate that. Um, Last segment of the show, I've got 5 questions I ask all my guests. John, are you up for answering them?
Absolutely.
All right. First question. What's your biggest key to a successful day?
All right. So I would say that it always starts with the night before. And this is usually referring to sleep. So making sure that I get to bed at a consistent time and get good quality and quantity of sleep is going to set the stage for the following day. I think that's huge. I notice if, my sleep schedule's all whack, I don't feel 100% effective the next day. So I think getting sleep is huge, not only from a productivity standard, but also from, my fitness goals that I'm trying to achieve, right? You need good sleep for that. So sleep is huge. It sets the tone for a nice, productive, and positive day. And then also too, I like to accomplish what I would call, or what most people call, like the most important task of the day. So if there's something that I know has to get done tomorrow, whether it's making a social media post, whether it's posting in my Discord, whether it's making a client's training program for fitness and movement, I make sure that I accomplish that at some point in the day and I set time to do it. So I really think that is the biggest keys for a successful day for me.
Okay. So what's the ideal sleep number?
I always shoot for between 8 and 9, but it's usually between like 7.5 and 8.5 is usually where I fall.
Nice. Question number 2. What do you wish someone would have told you 5 years ago today that might change the way you do things, the way you practice?
Yeah, this is a good question, and makes me definitely think. I would say I wish somebody told me to not only improve your clinical skills, but start studying and improving your skills with like human psychology, right? So things to help you appeal better to the population that you're trying to serve, right? How do you gather their attention better, and how do you speak to their desires and their problems? I'm fully entrenched in this now, and I have been for the last few years. But 5 years ago, if I were to rewind, I wish somebody would have told me to do that a little bit sooner.
Hmm. Okay. Question number 3. What book or product has impacted you the most over the last 3 months?
So I would say I read a book on sales. It's called Sell or Be Sold, and it's by Grant Cardone. And I really think it's a great book and a resource for any entrepreneurs, and not only entrepreneurs, but just even if you're a therapist working for a company, it's just how do you convey your value? So I think it really changes the way you think and approach sales. So obviously sales gets such a negative connotation. People are always trying to quote unquote sell you on something. They only care about themselves. And, rightfully so, there's always some truth to a stereotype. But I feel like this book really kind of spins the way you should really think about sales, especially if you have a good product and you have a good service that you believe in. If you truly believe that you can help somebody and provide value, you're not trying to like sell them. You're just trying to help solve their problems. And I think if you can convey that message, not only are you going to be more fulfilled, and I don't just mean financially, but also, psychologically, like, wow, I really have helped this person, but you're also going to actually help them and they're going to get better at doing that. So, I think, showing that you truly believe in what you do and your product is a game changer and just a way to convey that to your audience.
Okay. Do you have any just quick tips on how you might apply that to practice, like day to day working with a patient, like how you sell your value as a physical therapist?
I think it comes from asking a lot of skilled questions where you're getting the patient or your client to kind of convince themselves that, like, yeah, I need to do this, right? So kind of like, for a quick example that pops to the top of my head, like, what have you been doing for your knee pain for the last 2 months? Oh, I've been doing X, Y, and Z. Okay. And, then you ask, well, how's that helped you? What do you like about it? What do you not like about it? And then they'll tell you, if you're being genuine and you're in a conversation, they're going to tell you about it.
Mhm.
And, they usually they tell themselves the right answer. They're like, well, it's helped me a little bit, but I'm still where I am. I still can't do X, Y, and Z. And then they're like, well, I think I need your help. And then you come in and say, listen, like, I agree. I think I can give you a blueprint to get from point A to point B. So
Mhm.
I think that's one way to apply that kind of knowledge on a day-to-day basis.
Okay. Question number 4. What's a quote you live by or one that's drastically impacted your life?
So there's so many good quotes out there, and they can apply to you in so many different contexts. So it's really hard to pick one, but I really like the one: the harder you work, the harder I work, the luckier I get. Right? There's a couple different spin-offs of that one, but I think it's so true for most things in life. If you put the work in and make it a habit, you'll be leaps and bounds better than you were, say, 3, 6 months ago or a year ago. Um, and guess what? Opportunity is going to knock at your door in one way, shape, or form. And if you put the work in preceding that, then you can make the most out of that opportunity. And it's so true. I've lived it myself, and I feel like just putting in the daily work and the daily habits is going to prepare you for anything, whether it's an opportunity that presents itself to you or an opportunity that you create. Right? You're going to be ready for it, and you're going to find yourself getting luckier on the surface. Right? It's like, wow, this all is coming together for me. But it's really like you've laid the foundation to be ready for that situation. So I think that quote is is definitely one that I really vibe with. And and that's kind of like, not to dovetail back into it, but that's also one of the reasons why I started the Discord. Is if you can get a little bit better every day, lay those habits, guess what, you're going to make a big career move, or start your own business or whatever it may be, because you're ready for it.
Mhm. All right. Final question, signature question of the show. John Kahl, what is your favorite snack?
All right, so this is the hardest question of them all, because I am a food lover. I am not picky at all. For those who know me, know I will pretty much eat mostly anything. I'm not picky. I do have preferences, but I like to eat a lot of different things and I like variety. However, I will say that the most common snack that I have is something that has protein in it, whether it's a protein shake, a protein bar, Greek yogurt with some fruit. So I would say that's my most common snack.
Okay.
But I also like my indulgent stuff. So, if we have banana bread, guess what I'm gonna snack for at part of the day? I'm gonna have banana bread or whatever it may be. You know what I mean? So,
Mhm.
I try to limit those, but my snacks are pretty wide in variety. But typically, they're gonna have some sort of protein in them.
All right. Thank you so much for having this conversation with me. I learned a little bit more about the world of sports yet again. And I feel like you provided a lot of great information that my listeners are going to enjoy. Um, John, if people want to figure out more about you, or where can they find you? What resources do you have they can follow?
Yes. So I'll give you three Instagram handles. So one is for my sports physical therapy, continuing education, and mentorship for the Discord. And that is on Instagram. It's my first and last name, PT. So it's John Kahl PT. For fitness and movement, if for my online training and physique improvements, hypertrophy training, that is Fitness and Movement LLC on Instagram and Facebook. And then for St. Charles Sports Medicine, I have the Instagram handle St. Charles Sports Med on Instagram.
All right. Sounds good. Thanks so much for listening, everyone, and we'll see you on the next one.